We've done it. We've actually finished season 1. So here are the season 1 awards requested by Tree Poplar. We've got everything from funniest moment to the most clutch house decision. So watch until the end for that. So the most shocking moment was when we realized patient C was house in 3 stories.
His MRI showed that the leg pain wasn't caused by the self-injection. It wasn't caused by an infection. It was an aneurysm that clotted, leading to an infarction.
Wait, is patient C house?
We have to do the surgery.
Damn! Oh my god, what a plot twist! That is incredible. To be fair, that does remind me of a talk that a family medicine physician gave us in training, where he was talking about him getting prostate cancer, having surgery and being left incontinent. I've never seen a group of students so interested by incontinence pads. Hearing a physician talk about their personal experience is just so compelling. So no wonder we're so engrossed, and this just makes it so much more interesting. The funniest moment was when House was roasting Vogler at the end of Role Model, then saying directly to his face, "I threw in a joke."
Making not just a pointless new pill, but millions and millions of dollars. Which is good for everybody, right? It's patients. But let's have a big round of applause for Ed Vogler. I threw in a joke.
I threw in a joke. I threw in a joke. Talk about adding insult to injury. There's going to be more backlash from this than an MP cheating scandal. What a role model. I've seen better examples of social distancing from a herd of seals. Well done, Health Secretary. I want to see what Vogler does to the team now, because he doesn't seem like the type of guy that will just let this slide. Really liking this episode. So many unique themes for me to talk about. The saddest moment has definitely got to be the baby dying in the maternity episode.
Ben line. BP 60 over 20. B-fib. Clear.
Chase. Time of death, 6:57 p.m.
As Trianum's Pseudomonas kid died, that is tough to see. What makes it even tougher is that Cameron gave the parents hope. She didn't tell them how sick their child was because she was very scared to face the truth. Maybe she had some kind of trauma from her past that makes it difficult. Maybe she's lost a child in her past. Guess we're going to find out when the story unfolds in later episodes. So let's tentatively assume the other child has MRSA and the vancomycin is going to cure them and it isn't causing them kidney failure, although the fact that this is house means all of that's probably wrong. Best diagnosis, this one has got to be acute intermittent perforia in Honeymoon, episode 22.
Start the treatment. Hematin and glucose.
Only one way to confirm AIP. Urine sample made during the attack.
Barbiturates, alcohol, high levels of protein will set off an attack. That's why I'm going to give in the combo plate. All of it.
Welcome to House's House of Cocktails. What would you like today? The Reaper Dance. Excellent choice. A little bit of orange juice, squeeze of lime. And the secret ingredient, phenobarbital. It packs a bigger punch than me sleeping with your wife. So House wants to trigger an attack so he can diagnose porphyria, which, to be fair, is quite accurate, since it's quite difficult to diagnose porphyria when the attack has subsided, except with a genetic test which can take about 3 weeks. It'd be rare for porphyria to be this progressive though, and people with the condition have a normal life expectancy. So how do the drugs House wants to give the patient trigger this condition? Well, essentially, there is a heme metabolic pathway, of which an enzyme known as 5-aminolevulinate synthase, or ALAS1, is the rate-limiting step or gatekeeper of the pathway. Now, further down in the pathway in acute intermittent porphyria, there is reduced activity of an enzyme called perfobilinogen deaminase. That means that when ALAS1 is induced, metabolites such as perfobilinogen and aminolevulinic acid build up in the blood. These can lead to the neurovisceral symptoms that we saw the patient here having. So drugs that increase levels of this ALAS1 enzyme cause the buildup of these metabolites. There are loads of things that can induce it as well, like alcohol or starvation states can increase its activity, and that's why House wanted to give the patient glucose during the attack to reduce the activity of ALAS1. Heme helps to inhibit this pathway by building up the free heme pool, which acts as a negative feedback loop, telling the enzyme to stop as well. Very interesting.
The least accurate moment is when Chase said that he saw the pulmonary embolism on an ultrasound in babies in bathwater. Yeah, that didn't happen.
I hear they're firing the handsome doctor today.
That's dropping down to the 80s.
There it is.
Pulmonary embolus.
Gotta get it to a no R.
Oh, this poor woman really isn't having a good day. She also has so many risk factors for getting a blood clot. She has cancer, has been immobile for more than 3 days, and is pregnant. Just pregnancy increases the risk of a blood clot by 5 times. These are why hospitals risk assess every patient who enters for blood clot risk. And if you've been in a hospital, you probably know those small injections we give to thin the blood called low molecular weight heparin. That can dramatically reduce the risk of a blood clot, but not eliminate it completely. Having had the C-section would have at least helped with the pregnancy part of the risk factors, but recent surgery is a risk in itself. Damned if you do, damned if you don't. Wait, isn't that a House episode title? One thing that isn't quite accurate here is that Chase said he saw the pulmonary embolus when Foreman was doing the ultrasound. If you looked on the screen, it was actually the heart showing, and that's for good reason. Can't actually see a pulmonary embolus on ultrasound. You can see the things that may point towards it though, like right heart strain, but that definitely isn't diagnostic. You'd want a nuclear medicine VQ scan in a pregnant woman, but since this is an emergency and they take a while to get, you may opt to do a CTPA, even though it could potentially harm the fetus, or you could decide to treat the embolism blind if you have a reasonable suspicion of what it is. Most interesting moment, I'd say, for me as someone without a great car, it was House getting gifted the car in Mob Rules.
My car's been stolen.
Or reincarnated. A gift from the Arnello brother.
Gotta take the car.
You obviously can't keep it.
Nice car. Looks like a generous gangster rewarding House for his compliance, but under that shiny 1965 hood is extortion. What they're really saying is accept the gift and you get to keep the car and both your kneecaps. It's as the Colombians say, plato or plomo, silver or lead. You choose. If he accepts the gift, he also becomes indebted to them, so he's screwed either way. Interestingly though, House's way of practicing medicine aligns so neatly with what the mob want. Maybe that's how this series ends. The reason why House is so addicted to drugs is because he's manufacturing them. Cringiest moment has got to be when Foreman dismissed that homeless woman's symptoms and then she actually had rabies and histories.
Homeless, admitted 24 hours ago with a suspected drug overdose. Her tox screen's clean, but she's still delusional. I noticed a twitch. Her wrist.
She's manipulating me.
Ooh, if she's manipulating Wilson, then she's 110% committed, because not everyone can just let their hand smack their face. That's how they see if a patient is unconscious or not. If they're conscious, they'll stop it. I hope it's obvious that we don't use this method much. What's much better is to say, we're about to get the rectal diazepam. And if they keep going through that, then they're almost certainly not faking. Now, the patient is homeless, which leads to so much stigma in healthcare because A&E departments are disproportionately filled with homeless patients because of their high risk of drug use, alcoholism, tuberculosis risk, which she could full well have. They take less care of personal hygiene and vitamins, and so more at risk of skin infections and nutrient deficiencies. They really are a vulnerable group, so it's really important that we treat them just like other patients. Then this happened, almost like instant karmic justice.
Salty. Chemical imbalance. Hang a banana bag, give her 24 hours to correct the electrolyte imbalance. We'll take it from there.
Who's James?
Whoa! Foreman was trying to hold her down and she mistook him for dinner. They wanted to find out who she is, and now we know that she's probably a cannibal from Papua New Guinea. I also can't believe that House just diagnosed a potassium deficiency from the taste of her vomit. I really shouldn't have eaten before this episode. Now she's got a banana bag, which must mean potassium since bananas are high in potassium. But why not do just the blood tests? Please, someone just take her blood. Foreman, see, she's taking yours. I'd say the most accurate moment in season 1 was the measles incidence timings in paternity.
Biological mother was a baby. Did she get her vaccinations?
An infant picks up a regular old measles virus.
Once every million or so times, the virus mutates.
What? Measles? Because the mother wasn't vaccinated. So he didn't get protection through breast milk? That's so crazy rare. I'm actually not sure what the complication that can be caused by this is. This one I've never heard of before. Interestingly though, the incidence of measles in the US around the time this child would have been born was actually very high, almost 10,000 in a year. Compared to when this was filmed, it's about 50. So that's pretty accurate from the script writers. I'll give them that. Very good. Seems like it's a measles complications. If it's a measles complication though, it would be very difficult to treat since we don't really have great antivirals for it. Fingers crossed. The most clutch House decision when he had to kill one baby to save another's life.
Which drug's causing the kidney failure?
Take him off Astray now.
I vote to take him off the vancomycin.
Therapeutic trial. Find the cause of the infection.
What? A house wants to conduct a clinical trial right now on these babies to see which lives and which dies, sacrificing one baby to try and save the other. Very spicy. The most memorable moment, Wilson standing up for House in Babies in Bathwater.
I hereby move to revoke the tenure of Dr. Gregory House and terminate his employment at this hospital effective immediately. All in favor? Dr. Wilson.
Opposed?
Did Cuddy just turn on House? I'm gonna need a therapist after this one. In all fairness, peer pressure, scientifically known as social conformity, is one of the strongest psychological motivators. You can see its power in the famous brain experiment that was caught on camera. An unknowing participant walks into a waiting room, hears a beep, and causes everyone to stand up. It takes just 3 beeps of seeing it happen for her to give in and start standing up too. Even with having no idea what the reason is, our brains crave conformity and synchronicity. It takes much more will to go against the pack, as we intuitively know that there is power in numbers, but sometimes that is the right option. Well done, Wilson, for standing up in what you believe in. I will wave a small flag for you at your funeral.
Dr. Wilson, would you mind leaving the room, please?
You can't void my vote by making me stand in the hallway.
This vote is whether to dismiss Dr. James Wilson.
This is getting spicy. I love House episode names because they're always so intelligently crafted. From the old saying, don't throw the baby out with the bathwater, that I sneakily snuck in earlier. Seems like Wilson is the baby and House is the bathwater on this one. They've even made sure that Wilson has the right hairless baby face to fit. Although Cuddy could probably live with herself acting House, but Wilson as well? Surely that would be a step too far, but a very interesting episode too far. Overall, best and most entertaining episode has definitely got to be 3 Stories, episode 21. That was incredible. That wraps up all of season 1. I'm so excited to get into season 2. But if you want to review the best episode of season 1 before we do that, then check it out here. I'm Sermed. Stay curious.